Hi everyone, welcome back to my channel and you're watching The Brown Feminist. Now if you are new to my channel, then welcome aboard. My name is Faria and I run this channel as The Brown Feminist. I am a research nurse. I'm a registered nurse working in Canada. I work as a clinical research associate at a hospital site and I live with my husband and our 3 cats. So in this video, I've tried to, kind of portray a typical day in my life working and living as a clinical research associate for a hospital site. My days usually start off very early. It varies a little bit depending on, when my first patient is scheduled to come in that day. But on a typical day, I'm up and about getting dressed around 6:30 in the morning, having some breakfast if there's time, otherwise just packing my lunch and heading off to work. I try to have a high protein lunch. I do have PCOS and, proteins just, keep you going for the whole duration of the day until I have time to have lunch around noon. The first thing I usually do is set up my computer, check my emails. Now I do have a desktop computer at my office, but I still like sticking to my laptop because sometimes I'm moving room to room as we're doing different procedures with the patients. So I have my office issued laptop that I'm using majority of the time. I've also worked the last few years in the same place and built wonderful relationships with all the other associate staff. So first thing I do in the morning is usually make a list of my patients that I'm supposed to see that day. I'm expecting them to come in and then share it with the front desk clerk, who's also really amazing at their job. They come and get me as soon as the patient is checked in. They also kind of facilitate the process so I can approach new patients. Now, this portion of my job is very similar to what research coordinators do when they're recruiting patients. And typically, as an associate, I wouldn't be doing them. We do have other coordinators who do work like this, but there are some studies which are a little bit trickier to recruit for, particularly our investigator-initiated stuff that's physician-led. So I do a little bit of coordination for those studies. However, the majority of my work involves data analysis, data cleaning, project management, a lot of manuscript writing, a lot of training research assistants and coordinators on, data extractions and things like that, a lot of troubleshooting, lots of REB work with amendments. I also facilitate most of the work that we do with third-party sites, including all of our clinical epidemiology projects that we do. So a lot of the times I'm doing meetings, reading over reports to make sure all of the work is on deadline, within budget, kind of connecting with the developers, connecting with the analysts, with the PIs to make sure we have all the information we need in a timely manner in order to kind of produce the results that we have to. Once it's noon, I head off and enjoy some lunch. Sometimes I'll buy lunch. On this particular day, I brought lunch from home. Now, it might not look super delicious to you guys, but it is curry and rice, which is my favorite food to eat ever. So I'm kind of laughing because I'm used to looking at the camera and eating food. It is a little bit awkward. There is a staff room, but on this day, since I was recording, I decided to eat in my office. And then is my favorite part of the day. So in the summers, I'll go out for a nice walk. But in the winters, I usually do some stretches in our yoga room. So all of the hospital sites I work at have this amazing staff room where you can do stretches, yoga, just take a nap, relax, get some sunlight in. I also have other days when I use the massage chair for a full 20 minutes and just relax there. So it is definitely my favorite time of the day. Here are a few clips from some other days as well when I totally joy out on the massage chair. And I also noticed they were selling some scrubs, so I'll really have to go back to that place and look into what kind of scrubs they're selling. But that's pretty much a typical day. I go back and work for another few hours, and before you know it, it's 4 o'clock and it's time to go home. I'll see you guys next time. Bye.